Welcome to the tibial distraction exercise video. Alright, so this particular technique is quite simple but very effective in decompressing the knee. Now it can be used with osteoarthritis if you've got an acute flare-up of that, or just like a knee strain itself that involves the meniscus, which are the shock absorbing structures within the knee. So it's basically one of those techniques. You give it a go, and if it works, great, you keep it going. But if you give it a go for a couple of hours to maybe a day or so, and if it doesn't really work for you, it doesn't really give you pain relief and make the knee feel better, then clearly it's not a technique that's effective for you, so you wouldn't use it. You'd be using all the other techniques that I'll be showing you on the website. Okay. Now, what you understand with the knee is that when you're in standing and walking around, 80% of your body weight goes through your knees when you're doing that task. Alright? So when I'm sitting down, not really doing much, my body weight's not putting a lot of pressure on my knees. But as soon as I stand up and walk around, that weight really does increase. It doesn't really go a lot through the ankles or through the hips, mostly through the knees. So when you have a knee injury, you will have to kind of get off your legs as much as you can. Okay? So because standing and walking around is going to stress it out. Okay? Now you can see I'm sitting on a bench that's up quite high. My feet are well off the ground, but not everyone's going to have this bench to be sitting on, but you can use tables and chairs and even low chairs that are at 90 degrees and maybe a little bit too low for this technique. But essentially you need to be having your feet off the ground. That's super important. Okay. Now, regardless of what you're sitting on, you also need two fingers between the back of the knee and the surface you're sitting on. Okay. If you're too far forward, okay, and there's a whole hand distance there, it's not going to create the right position, so then the knee can be decompressed and tractioned. So if you're too far back, okay, and the back of your knees are right up against the table or chair, okay, you're still not going to create that lever that we're after. So you really just kind of get two fingers like that, like you're shooting a gun, and get that in behind the back of the knee and the table or chair that you're sitting on, okay? And that distance is really important, okay? What happens is the table or chair that you're kind of sitting on pushes the femur up, the weight of your leg and tibia pulls down, okay, and you get this nice little stretch in all these structures and all these soft tissues in here, okay, within the knee. And when they're getting that nice decompression through there, they can heal, they can feel better, and they won't inflame as much. But if you're standing, walking around too much, and you're kind of squashing it and compressing it and jamming it up, it gets very irritable very quickly. Okay, so inevitably, if you're having to do a lot of walking or standing, maybe with your work or at home, then you're going to need to do a lot of these. Okay, maybe before you do that task, okay, do your walking and standing tasks, and then do some of these straight afterwards to decompress the knee. Okay, but if you're doing a lot of sitting and just sedentary stuff, you won't need to do a lot of this. Alright, so just say for example my chair is a little bit lower, and just say my feet are touching the ground. You can use towels and cushions and whatever you line around the house, just to kind of pop underneath there, okay? Just to prop you up a little bit, and that'll bring the feet up off the ground, okay? Try and do it bilaterally. You don't, just say my right leg is affected, okay? And if I was to do that for too long, you can see it throwing my hips off a little bit and my posture off a little bit. So short term that should be okay, but you're going to be doing this for about 1 to 2 weeks, so you want to make sure that it's nice and level, okay? So make sure you do it over both sides. Alright, so we've got our 2-finger gap in between the back of the knee and the bed. Our feet are off the ground, okay? That's it, okay? So you really just got to stay in that position for about 20 or 30 seconds, okay? And then it might start to stiffen up a little bit, so you just kind of every now and then just give a bit of a move like that. There's a lubricant in your knee called synovial fluid, okay? It doesn't really flow within your knee if you're keeping it still like this, okay? So just every now and then just kind of give the knees a little bit of a move like that, okay? Just to promote that fluid to go into your knees, and then just let it rest again, okay? Make sure you've got those gaps, okay? Read a book, turn on your phone, do whatever you want to do here, okay? Have a cup of coffee, but just be in the right position, okay? And then you can do that for as long as you want, as often you want, as long as you need to. Alright, so the towels and cushions, basically, you'll need to kind of take them with you if you're going to work and stuff like that. So you'll need something that you can fit into a handbag or something like that at work. Now you must perform this technique. Say for example, you know, I've got a job or stuff around the house I've got to do for more than 20-30 minutes of standing and walking. Like I said before, you've got to do just a couple of minutes of this before you get up and do your standing task. So you deload the knee, decompress it, then you do your particular walking standing task, and then if you can, then straight away deload it. Okay? You do that regularly throughout the day, and inflammation won't build up within the knee and won't be sore at night time. Okay? But if you don't do this as often, you'll keep compressing the knee, it'll keep irritating and keep inflaming. And you could be doing all the other great things to reduce the inflammation within the knee. Obviously those techniques we refer to on the website, but it means nothing if you're not decompressing and taking all the stress away from it. Okay? So keep this exercise real simple. Okay? It doesn't have to be complicated. Okay? But just doing it often is the real key with this one. Okay? Thanks for watching.